we'll be talking about a common and an important organ in the human body. It forms a major part of the gastrointestinal tract. Before then, if you haven't subscribed to my YouTube channel, I want you to do that right away. I want you to like this video, make your comments, and click on the subscribe button. Thank you.
Introduction. The stomach is the widest and most distensible part of the alimentary canal between the esophagus and the duodenum. In this diagram, you can see the stomach lying between the esophagus above and the duodenum below. Where is the stomach located? The abdomen is divided into 9 quadrants, and the stomach occupies only 3 regions at the left upper part of the abdomen. These 9 quadrants are the right hypochondriac, the epigastric and the left hypochondriac, the right lumbar, the umbilical and the left lumbar, the right iliac, the hypogastric and the left iliac. The stomach occupies the left hypochondriac, the epigastric and the umbilical region. Also, the organ lies behind the covering of the lower left costal ribs and cartilages. The stomach is J-shaped, has length of 10 inches, capacity is 30 ml at birth, 1000 ml at puberty, and 1500 at adult. External features of the stomach. The organ has 2 ends, 2 curvatures, and 2 surfaces. The 2 ends are the cardiac end and the pyloric end. The 2 curvatures are the greater and the lesser curvatures. The 2 surfaces are the anterior surface and the posterior surface. Internal features of the stomach. It has gastric foldings which are longitudinally arranged at the region of the lesser curvature and are called the gastric canal. At the other region, they are irregularly arranged and are called gastric foldings or rugae. Interspersed among the gastric foldings are the gastric pits. What are the various parts of the stomach? The organ is divided into the cardiac part, the fundus, the body, and the pyloric part. The cardiac part is seen around the cardiac orifice, whereas the pyloric part is seen around the pyloric orifice and is divided into the pyloric antrum, the pyloric canal, and the pylorus. The stomach has both peritoneal and visceral relations. The peritoneal relations refers to the ligaments that are attached to the greater curvature and the lesser curvature region. Attached to the greater curvature includes the gastrophrenic ligament, gastrosplenic ligament, and the greater omentum. Attached to the lesser curvature region are the hepatogastric ligament, hepatoduodenal ligament, and they constitute the lesser omentum. The bare area of the stomach gives no attachment to any ligament. The greater omentum is also called the policeman of the abdomen. The visceral relations are divided into anterior and posterior. For the anterior visceral relations, this refers to the various structures that are related to the anterior part of the stomach. From the diagram, you can see the part that is related to the diaphragm and the costal margin. Next is the part related to the left lobe of the liver, and then the part that is related to the anterior abdominal wall.
That is it about the anterior visceral relations. Now we will be talking about the posterior visceral relations, the structures of which forms the stomach bed.
For the posterior visceral relations, also known as the stomach bed, we will be using the mnemonic Dr. S4 kills patients mercilessly. The D in the doctor stands for the diaphragm. The first S stands for the splenic artery. The second S stands for the spleen. The third S stands for the left suprarenal gland. Then the last S stands for the splenic flexure of the colon. The K in kill stands for the left kidney. The P in patient stands for the pancreas. Finally, the M in mercilessly stands for the transverse mesocolon. Arterial supply. The organ is supplied by the direct and indirect branches of the celiac trunk. These include the left gastric artery, a direct branch of the celiac trunk. The right gastric artery arising from the common hepatic branch of the celiac trunk. The left gastroepiploic artery arising from the splenic artery. The right gastroepiploic artery arising from the gastroduodenal artery. And also we have the short gastric arteries arising from the splenic artery. Venous drainage. The organ is drained by concomitant veins which corresponds to the artery accordingly. We have the left gastric vein draining into the portal vein. We have the right gastric vein which also drains into the portal vein. We have the left gastroepiploic vein which drains into the splenic vein. We have the right gastroepiploic vein which drains into the portal vein. Lastly, we have the short gastric veins which drains into the splenic vein. Lymphatic drainage of the stomach. We have the left gastric nodes. We have the right gastric nodes. The left gastroepiploic nodes. The right gastroepiploic nodes. And the pyloric nodes. The various group of lymph nodes drains the corresponding parts of the stomach. They finally drain into the celiac node. Nerve supply. It has sympathetic innervation of T6 to T10 and parasympathetic innervation from the vagus nerve, and these include the anterior and posterior vagal trunk. Lastly, clinical correlates. Gastric pain is referred to the epigastric region because stomach is supplied by T6 to T10. Gastric cancer, this spreads via the lymph vessels. Crucial sign is the presence of enlarged and palpable left supraclavicular node. It's used to detect gastric cancer. Egotomy can be done to cure chronic duodenal ulcer.
Alright guys, I hope you enjoyed this video. Please don't forget to like, comment and subscribe. Thank you.